Today in Moscow Avenue Park, we will discuss many of the medications that you should never use after the expiry date. There are many drugs that you can use after the expiry date because they just lose minor amount of their activity. Some painkillers, some vitamins, you may lose some part of the activity and you can still use it. It will not harm you. However, there are certain medications, it is very dangerous not to strictly follow the expiry date. These medications you must know and you should never use after the expiry date. One of them is the tetracycline. All the tetracycline antibiotics, for example, demoxycycline, doxycycline, tetracycline, all these antibiotics should never be used after the expiry date because they will form very toxic compounds that can cause liver necrosis or kidney failure. So we should never use these medications after the expiry date. And the second most important is the nitroglycerin. Nitroglycerin, which used for angina attack, should never be used after the expiry date. Actually, you should always check any patient who is using nitroglycerin. You should always check your stock of nitroglycerin to be up to date always. Every 3 months, you should renew your medications of nitroglycerin to be most recent. It's very affordable medication, and the use of this medication in the case of angina, any heart attack, and the use of this medication after the expiry date can be lethal. It can cause the exacerbation of the heart attack and the angina attack and can cause sudden cardiac death. And the third most important is the asthma. Asthma medications are very important to follow the strict expiry date because the epinephrine, it's not a stable compound after the beta agonists, which are those that dilate the bronchioles of the lungs. So after the expiry date, they are not stable compounds and they can exacerbate the asthmatic attack. So it can result in respiratory arrest. And the other medications that should strictly be monitored for expiry date is the epinephrine, the adrenaline that is used for allergy. It should never be used after the expiry date unless it's the only available. But for example, if you have a stock of epinephrine that you use, for example, any pharmacy or home pharmacy, you should always check your epinephrine expiry date and keep it up to date, because if you use it in the emergency and after the expiry date, there is very high probability that it will fail to develop the desired effect of relaxation of the bronchioles that is necessary for breathing in this very serious asthmatic reaction. And lastly, but not least, because there are other medications we should follow the expiry date, is the insulin. Insulin is a very sensitive compound. Actually, it is a polypeptide. So the stability is very fragile outside the specified date of validity. So you should always check your insulin. If there is any patient who is using insulin, should always check the expiry date and replace any expired medications of insulin, because they will disintegrate very quickly after the expiry date, because it's not a simple chemical compound, it's a polypeptide made of several amino acids that are gathered with a strict combination. And finally, always check before you use any medication how long you can use it, and I wish you good health always.